Hello, everyone. I'm Assemblyman Obernolte. I wanted to give you a brief update on what's happening with the state and federal government's response to the coronavirus. Here in California, just today, we passed over 3,800 active cases with 78 deaths. In San Bernardino County, we have 55 cases that we're tracking with 3 deaths. There have been some very promising developments in the last 48 hours with regards to our healthcare infrastructure. As you know, the most frightening thing about this epidemic has been the fact that this virus has a 20% hospitalization rate. And if you look at the number of people who are likely to contract it, and you take 20% of those people who might need hospital care, and you compare that with the amount of hospital beds that we have available, it would just completely overwhelm our hospital system. So that is what we've been working to rectify. And I'm very happy that we've made some really great steps in the last week with respect to that. We have a hospital ship, the USS Mercy, that has docked now in Los Angeles that's providing an extra hospital's worth of bed capacity. And also, several weeks ago, the legislature passed a $500 million aid package that included the ability for the governor to lease hospital space. And he has concluded, just in the last 24 hours, leases on 2 closed hospitals, one in Northern California, one in Southern California. So that's really going to aid the state's hospital capacity. Here in San Bernardino County, we are really ramping up our ability to do testing. In fact, there is now an operational drive-through coronavirus test facility in San Bernardino, and we are looking to expand that with drive-through locations in other places, including in Big Bear Lake. Now, I want to talk just for a second about who needs to be tested. This is a very important subject, and I want to make this very clear. You do not need to be tested for coronavirus just because you think you might have it. You are only needed to be tested if you're doing so under the direction of your healthcare provider. And what your healthcare provider will tell you is that the tests are the most important for people for whom a positive diagnosis would change the course of treatment. In other words, if the doctor needs that information to figure out how to treat your illness, then you definitely need to get tested, and they will advise you on how to do that. But if you're feeling sick at all, you should be self-quarantining at home anyway. Testing really is not necessary in those cases. So please talk to your healthcare provider about that. Very exciting news at the federal level. Just today, the House of Representatives passed and President Trump signed into law the largest relief package in U.S. history, $2 trillion with a T of relief package, and with a number of provisions that are really going to help us get through this crisis. And I wanted to walk you through some of the most beneficial ones. First of all, as you might have heard, there's going to be direct aid payments to every American that meets the income requirements of $1,200 per adult, every adult, and $500 per child. And you're eligible for that up to $75,000 of adjusted gross income for people filing singly, $150,000 for married couples. And it phases out up at a level of $99,000 per person. So if you make between $75,000 and $99,000, you'll get proportionally less. So I've had a lot of people ask me, Jay, how do I get my relief check? Well, you shouldn't have to do anything. The IRS will be sending those relief checks out automatically based on your income from last year. Usually for most people, since most people haven't filed their taxes yet, that'll be from 2018. If the IRS has your bank account information, for example, if you paid taxes directly to them or received a refund check directly from them to your bank account in the past, it will come very quickly, I'm told, within the next several weeks. If they have to cut a check and mail it to you, it's going to take somewhat longer, probably another week or 2. So you shouldn't have to do anything to get access to those relief checks. In addition to that, the Congress has substantially increased unemployment benefits. They are layering a federal unemployment package on top of the existing state programs up to 4 months. So that's really going to help our workers that are finding themselves out of a job get through this crisis. Also, we are instituting a moratorium on student loan payments at the federal level, so that should definitely help. Also, there's going to be a small business loan program, because I don't have to tell you, all small businesses are really suffering and are going to need that package to get through. I want to correct a misperception. A lot of people think that this is a bailout. I don't view it that way at all. Most of the money that's being spent in this package is in the form of loans and not grants, and there are certainly strings attached to those loans. Wanted to talk really briefly about the overall climate, because I get questions all the time about how long are these restrictions going to be in effect and who do they apply to. So first of all, most of us should be practicing certainly social distancing of at least 6 feet between us. Whenever we are around other people, we should be isolating in our homes to the maximum extent possible. However, that doesn't mean that you can't go out of your home. You're encouraged to leave your house to go exercise. Just please keep at least 6 feet away from other people. Most businesses are closed, especially the ones that are public facing, but our essential businesses stay open. And if there's any question about what businesses are considered essential and which are not, I'd encourage you to go to my website, and I'll give you that information in a moment, or to the state's website, because the governor just a couple of days ago issued an executive order clarifying which businesses were essential, and all of the guidance that you need is out there. People are asking all the time, how much longer is this going to continue? Well, no one can say for sure, but at a lower bound, I would say at least for another several weeks, and an upper bound, perhaps, unfortunately, for another several months. And the reality is going to be somewhere in between those two extremes. We are closely monitoring the data on new infections every day and health care outcomes every day, and we're going to make the best decisions that we can to protect the people in our society based on the data that's coming in. I want to encourage you, please, first of all, follow the guidance of our health officials and your physician. I want to encourage people, please support your local small businesses. These businesses are really hurting, especially businesses in the hospitality industry, such as restaurants. So to the extent that you can, please patronize those businesses. Most of them are still open for takeout. Please call ahead, make an order. A lot of them have curbside service. Please tip generously because these businesses are suffering. Most of them have less than half of the amount of revenue that they would normally have. They're struggling to pay their workers. Please tip generously. Another thing I want to encourage you to consider is if you have maybe a manicurist, a cosmetologist that cuts your hair, someone that cleans your house normally that's not doing that right now, please consider sending them a check in the mail and writing in the memo that you're paying for services in advance, because we're all going to need to get our hair cut once this crisis is over, and it wouldn't do any harm to pay them for a haircut or two or a manicure or two in advance and really help them get through the situation. So I want to let you know that my district office is here for you if you have any questions that we can help you with to get you through this crisis. I'll give you our direct number. It's 760-244-5277. You can email us at assemblymember.obernolte, that's OBERNOLTE, at assembly.ca.gov. You can connect with me through our office website. If you just Google Assemblyman Obernolte and you can misspell it, it'll still work. It'll take you, the first thing that comes up is our Assembly website. If you want to write it down, it's AD33 at asmrc.org. That website, first of all, you can sign up for our email blast. You'll get regular updates from us. Also, there is a link to a list of resources for getting through this crisis, whether you're a small business, whether you're a struggling homeowner, whether you're someone who's lost their job, need access to unemployment benefits. All of those resources are there. Lastly, I want to encourage you to please be kind to each other. This is an incredibly stressful situation, and we need to make sure that our human kindness comes through, that we care about each other, that we extend to each other, the kindness and the affection that we all would expect, and that we make sure that we take care of our most vulnerable members of our society that are the most potentially vulnerable to this terrible virus. So I'm Assemblyman J. Obernolte. It's an honor to represent you. Please reach out to us if I can be of assistance to you during this crisis.